Hello students, welcome to the class of microbiology. Today we shall study about the contributions of Joseph Lister. Joseph Lister is also called as the father of antiseptic surgery. He was born on the 5th of April in 1827 in Upton, Essex in England. Before we go to the contributions of Joseph Lister, we shall study a bit introduction of Joseph Lister. Basically, Joseph Lister was a wine merchant and a devoted scientist. In 1847, he earned his bachelor's degree of arts from the University of London. In 1852, he earned his bachelor's degree in medicine and surgery. While a student at the university, he was awarded with 2 gold medals for his extraordinary performance in education. In 1852, he became the Fellow of the Royal College of Surgeons. In 1853, Lister was appointed as an assistant to James Syme, the greatest surgical teacher in those days. In 1856, he was appointed as a surgeon to the Edinburgh Royal Infirmary. In 1861, Lister was appointed as a surgeon in the Glasgow Royal Infirmary, where he was in charge of the wards in the new surgical block. As a manager, he hoped that the hospital diseases in their new building would decrease greatly due to the widespread acceptance of general anesthesia. But Lister's hope proved ineffective when Lister reported that in the male accident ward, between 45 to 50% of his amputation patients died from sepsis between 1861 to 1865. In the 1860s, the surgery was emerging and there was widespread acceptance of general anesthesia. Yet, in the wards of the average hospital, the odds of the patient surviving a surgical operation were about the same, like escaping alive from a battlefield. In the surgical wards, wound infections spread from patient to patient like wildfire. Compound fractures often ended up in hospital gangrene and amputation. The death rate from major surgical operations or limb amputation was as high as 40%, rising to up to 60% in the general French hospitals. Joseph Lister was always aware that the number of deaths after surgery were not caused by the operation itself, but by what follows after the procedure, because there was an alarming rate of ward fever, that is, infections, after surgery. Lister wondered what could be the cause of these events. So Joseph Lister compared patients who had simple fractures to those who had compound fractures. He concluded that the infections were coming from the outside, as the problem only occurred to those who had open wounds. The hygiene in the hospitals was unacceptable. Surgeons rarely washed their hands before visiting the patients. The surgeons did not change their clothes while operating. They wore the same street clothes which they wore outside. A smell, the putrefaction smell, was there on the surgeons' dresses or the clothes that they wore. They were not even ashamed to speak about the old hospital stink that occurred from their clothes. After performing the surgery, the doctors or the surgeons they circulated freely between the living patients they treated and the dead ones they dissected or autopsied. No attempts were made to isolate septic cases. The nurses and the persons who performed dressings on the wounds moved directly from patients with sepsis to the healthy ones. According to the prevailing theory of that time, wound infections, that is putrefaction, were usually attributed to gases, chiefly oxygen, which entered the wound and was responsible for the tissue breakdown. Different surgeons had different opinions about the air or the gas causing the infection. Opinions therefore varied from person to person about how the air became contaminated. But the observations of Semmelweis had made no impact on the conservative medical establishment of that time. Where Semmelweis was a surgeon in the labor ward where the females gave birth to the child. And if proper hygiene was not maintained, the female, after giving birth to the child, suffered from the puerperal fever, which was at that time also called as the childbed fever. But his observations did not affect the medical staff. Right? They thought that Semmelweis had gone mad or he was insane, and therefore people did or surgeons did not believe in Semmelweis. No surgeon ever risked opening an abdomen or even entering a small joint. Abscesses that were formed were left unopened. Rarely they were drained or treated by making incisions with valvular openings that would prevent the entry of oxygen. In those days, Louis Pasteur, a young chemist, was studying the process of fermentation, and he showed that human diseases occurring during life would also be caused by aerially transmitted germs. Louis Pasteur had observed that the growth of yeast in milk was responsible for the curdling of milk. Growth of certain yeast cells were responsible for the conversion of glucose to ethanol to make the wine from glucose. From these observations, he related it to the human life and thus said that microorganisms may be responsible for the diseases that are transmitted from one person to another, and these microorganisms may be transferred through the air. From Pasteur's findings, Joseph Lister learned that fermentation and putrefaction were not caused by gases of the air, but it was the living particles that were floating in the air which settled down on the surrounding objects and led to the sepsis or contamination of the wounds. Lister was also aware that microorganisms could be destroyed by boiling water or the broth. If these primitive forms of life could be destroyed by boiling, he thought, why not use chemicals to kill these organisms? So Lister started working on the use of chemicals. He came to know that antiseptic substances were used by early Egyptians. Alcohol, oil, wine, glycerine, chlorine, and iodine and coal tar were the various substances that were used by the Egyptians. By 1851, carbolic acid had been used in England to preserve the cadavers, that is, the dead bodies. In the 1860s, Jules Lemaitre published a paper on the use of carbolic acid in the treatment of wounds in Paris. But his research was largely ignored by the surgeons. All the substances like glycerine, chlorine, iodine, coal tar, or carbolic acid were the agents that were used for the treatment of infections and not for the prevention. After reading Pasteur's paper, Lister was convinced with the idea of preventing the surgical infections by destroying the microorganisms that caused it. So, he started using a substance which was called as the German creosote, which was used to clean up the sewage plant. It was available as 5% carbolic acid solution. Lister used carbolic acid first for a patient who was suffering from compound fracture on a leg. Lister took a small bottle of carbolic acid and poured some of the carbolic acid into the wound and made a paste of it by mixing the carbolic acid with blood. Then he covered the wound and added some fresh carbolic acid every day on the wound. The patient recovered with no infection. Between 1865 to 1867, he treated 11 cases of compound fractures, of which 9 healed without any infection. Next, he successfully removed a tumor from a man's arm by applying his antiseptic to the sutured wound, that is, the wound that was stitched, and then used it for several amputations. Also, for large ventral hernia that required removing a large amount of fat from the body, carbolic acid proved useful. So Lister's first successful use of his new method was on August 12, 1865, and in March 1867 he published a series of cases that he had performed using his new substance, that is carbolic acid. He started using the carbolic acid to wash his hands as well as to wash the surgical instruments he used during the operations. He started covering the wounds of the patients with a piece of bandage that was covered or that was dipped in carbolic acid. Lister had also devised a machine that helped to spray the air with carbolic acid in order to get rid of the airborne germs. He refined his techniques until he had enough proof that everything he did was successful, and he went on to publish a number of papers in of his discoveries in a medical journal, that is the Lancet, in 1867. The results were dramatic. Between 1865 to 1869, surgical death rate reduced from 45% to 15% in the male accident ward. It took long time for the people in the medical field to accept Lister's findings. Many of the medical practitioners did not believe that microorganisms that were so small that they could not be seen by the naked eyes were responsible to cause the post operation deaths. But some people believed in Lister's findings and tried to use his methods. But many of them used the methods incorrectly, and therefore the efforts that were put in by those medical practitioners or surgeons did not prove useful to them. So many of the surgeons gave a negative feedback on the use of carbolic acid and thus did not use or they stopped the use of carbolic acid. But although there was a negative feedback, Lister did not stop there. He continued to modify his system to achieve better results. Between 1865 to 1867, he treated 11 cases of compound fracture. 9 of them healed without any infection. Using carbolic acid, he successfully removed a tumor from a man's arm. Then he used carbolic acid for a number of amputations. He also removed a large ventral hernia from the patient, which required the removal of large amount of fat. But although a large amount of fat was removed, a large wound was caused. The use of carbolic acid by Joseph Lister prevented the sepsis or wound infection after the surgery. When using the carbolic acid, Lister found that the use of carbolic acid was irritating on the skin. So, he dissolved the carbolic acid in oil and mixed it with powdered chalk to form a paste that could be applied to the wound. To prevent secondary hemorrhage, he also used carbolic acid to sterilize the gut suturing material, that is, the thread and the needles that were used to stitch up the gut after the surgery. Lister did not stop at the use of carbolic acid. He tried to find different alternatives for the carbolic acid. So after 1870, Lister used absorbent gauze which was impregnated with various other antiseptic substances. So at first, Lister's antiseptic received mixed acceptance. His staff had approved his method and started using it. The Germans who studied the details of his technique also praised Lister, and most of the Germans started using the antiseptic for the patients. But Lister's technique was not accepted and used in London. Later in 1869, Lister left Glasgow to become a professor in surgery in Edinburgh. In 1877, he became the professor of surgery at the King's College Hospital in London. When in London, he tried to promote his method of using the antiseptics. The surgeons in London were neither impressed nor convinced by Lister's technique. One of the surgeons, while performing the operation, sarcastically asked the nurses to close the door of the operation theatre so as to not allow Lister's germs to come into the room. The nurses also grumbled because it was not their regular method to use it, and using Lister's method was a difficulty to work with. And the nurses thought that the wards in which they were serving were their private domains and did not allow any man to enter into it or to change the methods of their use in the private domains. But Lister prevailed. He was a superior. His reputation also grew. When the reputation grew, many of the surgeons were converted and started using Lister's method of antisepsis. By 1890, the whole world had accepted Lister's innovation, and by then the microbes causing sepsis had been identified and cultured in the laboratory. Eventually, most surgeons abandoned the process of antisepsis and switched to the antiseptic techniques. That is, instead of using antisepsis or substances on the wound, they started making the entire area of operation to be sterile. That is, switch from antisepsis to aseptic technique. Lister made many improvements in the surgery. He also invented useful surgical instruments. He invented an aortic tourniquet. He was the first to use carbolic acid to treat varicose veins. He was the first surgeon in Britain to use the rubber drainage tube to the patient who was the Queen of Britain, that is Queen Victoria. He is remembered as an innovator who revolutionized the history of surgery. With all his achievements, he finally retired in 1893. He was given a Royal Medal in the year 1880, the Albert Medal in 1894, and he was elected as the President of Royal College of Surgeons in 1895. He was made a baronet in 1897. He won the Copley Medal in 1902. Joseph Lister died in Walmer, Kent, England on February 10, 1912, at the age of 84. But today also he is remembered as an innovator who revolutionized the history of surgery. Thank you.